why a mesh is used in hernia repair and what are the associated risks. Hi, I am Dr. Praveen Koduru, Senior Consultant Laparoscopic Surgeon with Sree Nandaka Advanced Laparoscopy Center, which is also a center for hernia surgery. Today I am going to discuss about meshes used in hernia surgery. For the starters, this is a hernia mesh, a lightweight synthetic material that we use in the surgery which helps repair the hernia defect. As you can see, this mesh is very soft, pliable, easily bendable, and it doesn't restrict any body movements after it's placed inside the body. So, how does a mesh work? It creates a matrix or scaffolding for the new tissue ingrowth and it reinforces your own natural tissues, ultimately helping the hernia heal. I am often asked by my hernia patients questions like, am I going to have a mesh with my hernia repair? And if I do, what are the risks of having a mesh placed inside the body? Before we get started, let's first talk about what a hernia is. A hernia is a defect or a hole in the abdominal wall through which organs such as the intestines or bladder or fat can come out through. Sometimes these organs get stuck in those defects badly, resulting in obstruction and stagnation, which is a surgical emergency and a life-threatening condition. Generally, hernias form as a result of failure of your natural tissues to close spontaneously or failure to heal properly after a surgery. And this concept is important because simply sewing those tissues together is unlikely to result in a durable hernia repair. And that's where the meshes come in. A mesh offers reinforcement. It allows your scar plate to form, repairing the hernia properly. I very often take this example of a concrete slab to explain the mesh repair. A slab is a very strong structure, the mesh being the steel rebar and your body scar being the concrete. So if concrete alone without any reinforcement like steel rebar isn't as strong, and the same is true about your hernia repair. Having a mesh plus scar tissue creates a strong and durable repair in the long run. Does every hernia repair requires a mesh? No, not every hernia requires a mesh. Certainly, small ones like umbilical hernias which are less than 1 centimeter can be repaired with stitches alone. But anything larger and certainly those that are post-surgical hernias and very large groin hernias do ultimately require a mesh. In addition to size, these days, technique of surgical repair has also become a very important factor, with more and more surgeons focusing on minimally invasive surgical techniques like laparoscopic hernia repair or robotic hernia repairs. These almost always require a mesh to be placed. And because the recurrence rates of hernia with mesh repair are becoming negligible, more and more surgeons are giving up on tissue-based hernia repairs where no mesh is required. Now sometimes people ask, what is the hernia mesh made of anyway? Hernia meshes are made up from a bunch of different materials, but the most common types are synthetic material, specifically polypropylene or polyester or PVDF. These days we also have biological meshes which are completely absorbed after 3 months, but these meshes are very expensive. So now that we know why we place a hernia mesh and what meshes are made up of, it is important to understand what are the risks associated with mesh. The most common problem associated with a mesh repair is recurrence. Although hernia meshes are designed specifically to reduce the frequency of recurrence, they happen because of many factors like smaller size of the mesh, poor surgical technique, infections in post-operative period, etc. Another very important risk of concern is the risk of mesh infection. Since we are placing a foreign material in the body, there is always a risk that bacteria can colonize the mesh and form an abscess. And this can be a real problem where it's difficult to treat and actually to get rid of bacteria that is incorporated into the mesh. Very often we end up doing a repeat surgery and have the mesh completely removed to prevent and reduce the complications of that mesh infection. Now fortunately, newer types of mesh that are very lightweight and resistant to infection and newer techniques like minimally invasive keyhole surgeries or robotic surgeries seem to be reducing the risk of mesh infections, so that's something we can be excited about the future. One of the most feared complications that give the meshes a very bad reputation is the erosion of mesh. Mesh erosions and fistulization are more commonly seen when a mesh is used in other than non-hernia procedures meant for urinary incontinence or uterine or rectal prolapses, because the mesh is kept in close proximity to very sensitive tissues like bowel and bladder. Nevertheless, in some types of hernia surgery where an intraperitoneal onlay mesh or an IPOM is used, there is a very tiny chance of bowel adhesions, erosion and fistulization. Hence, newer hernia surgeons are adopting extraperitoneal repairs where the mesh is placed in such a way that it is not in contact with any vital structure, thereby preventing complications. So it's very important that you discuss with your surgeon what kind of mesh and what kind of technique they are going to be using when they are repairing your hernia. At the end of the day, most people are going to require a mesh to have a durable repair, and it's something to be aware of and not necessarily fearful of when you are making a decision about your hernia repair. Thank you for watching and have a great day. If you have any further queries about the mesh to be used, a hernia mesh, kindly comment in the section below. We'll definitely get back to you. If you like the content of this video, kindly like and share this video, and also subscribe to my YouTube channel for more such videos. Have a great day.